how would you approach the accelerator process the second time around? What would you look at now that you didn't know before?
If you're not giving up any equity at all, and there's even the possibility of introductions, it's totally worth it, right? It's totally worth it. It's going to be very time consuming, but the accelerator we participated here locally called Bronze Valley, we met a lot of people and they didn't take any equity and they were very helpful and it was in a very intense 7 weeks, but it was totally worth it. If an accelerator is going to take equity, even if it's a safe note that converts down the line, really understanding what you're getting from them in return for that equity. And also, if you don't gain traction in X amount of time, is there still going to be support? Are they still gonna actually help you? Are they actually going to make introductions? Are they gonna help you troubleshoot and problem solve? As far as going after investment from angels and investors, that's a whole other ball of wax. We ended up having 3 opportunities that came about all at the same time in the fall of 2021, and at this point, I'm out of money. I'm putting things on credit cards, it's ridiculous and we're just staying afloat. We did get a term sheet, but the actual terms of the term sheet were ridiculous. There was actually no cash. They were just going to give us sort of our services are worth X amount of money. And I was very fortunate that, despite COVID, this was year 2 of COVID, I was able to meet this team in person and they were a perfect fit on paper, these investors. Perfect fit. All they do is fund cancer startups. That's all they do. But once we got the term sheet, it was just funny that it wasn't over things like valuation, like you see on Shark Tank. They totally agree with our valuation. It was that, "Oh, we're not gonna actually put cash into this,
Oh, wow.
and we're just gonna offer this much services, and you're gonna give us this much percent." And it's like, "No, no, no, we've already done this rodeo with one of the accelerators." I met them in person. I liked all of them except for the one guy, and it was pretty clear to me he made the final decisions, and I knew he was gonna be difficult to work with. So you can't just take money from anybody. So my co-founder and I were on the same page. We turned down that term sheet.
What sort of metrics were they looking for that would make this process, this platform, this program work for them?
Well, there are multiple studies that show that the more educated and involved and active patients are, the more costs go down. And we really felt with a pilot, we could prove that out. We could prove that we could reduce cost for healthcare systems. We were looking at what the studies has shown in the past, hospital readmissions, ER visits, so can we like we had have a great example, a patient I met through Blue Fairy. She had 2 different kinds of liver cancer. She's discharged from the hospital after her first round of treatment. They give her no information, and she was seen at a pretty decent hospital, and her adult son is her primary caregiver. He had just turned 30, but they were given no instructions, and she ended up going to the ER 6 times in 12 weeks. 6
Oh, wow.
times. And
Mhm.
every time that's expensive for the healthcare system, but it's also really bad for her. It's like one of the worst places a patient with a compromised immune system can be is at a hospital. And I asked her, I said, "Well, what, how did you finally know when and when not to go to the ER?" And she said, "Oh, it was just trial and error. I finally figured it out." But nobody helped her. Nobody helped her understand. And so we felt like, right at the beginning, we could reduce ER costs, like start there,
Mhm.
but also that we could eventually reduce hospital readmissions.